Will you get a heart attack if you go to the gym? Recently in Salem, Tamil Nadu, there was an incident where a youngster, he was actually a gym owner and he was used to exercise. He was exercising in his gym in the night alone and he had a cardiac arrest and he is no more. This is an extremely unfortunate event. One reason is that the impact it has on the family and how exercise is seen by the people affected by this incident is going to be very difficult to change. So when something really bad happens, when the intention is to improve something, it creates a lot of anxiety in the human mind. So this video, I'm going to explain, is exercise really dangerous? Because it's quite obvious that it can be very dangerous and disastrous for some. So how does one person who's actually sick and is unhealthy and who wants to use exercise as a tool to improve their life start off? My name is Dr. Santosh Jacob. I'm an orthopedic and sports surgeon. I practice in Chennai, Tamil Nadu. We are going to start off with one, acute effects of exercise on the cardiovascular system. From that, we are going to go to point number 2, which is what are the pre-existing conditions which can occur which causes individuals who exercise to get cardiac arrests. Then the third point, we will be seeing what are the chronic effects of exercise. This actually will showcase the benefits of doing moderate, consistent exercise. We are going to be seeing why pre-screening for those who want to start exercise is essential and who will be really benefited by it. And finally, we will close this with how to approach exercise safely as somebody who wants to start exercise to improve their quality of life. So what are the acute effects of exercise on the heart? So even though this is a video for the public, most of the contents are taken from my lectures for postgraduates who I teach about how to give exercise prescriptions. So here we go. The essentials of strength and conditioning by CSCS and a lot of other medical texts and exercise physiology texts. Let's start. 1. Acute effects of exercise on the heart. During exercise, our body undergoes several immediate changes. Why does that happen? It happens because when we exercise, there is an increased demand of energy, blood, and oxygen. So when there is an increased demand, automatically the engine which supplies the demand has to work harder. So the first thing which happens is whenever you exercise acutely, your heart rate increases. Second, as you exercise and as your demand increases and as your heart starts to push more blood into your body, the blood vessels have to increase the pressure which they exert on the blood. So automatically your blood pressure also increases. So the second effect is increase of your blood pressure. The third thing is your cardiac output and stroke volume increases. So the volume of blood pumped out by your heart every minute increases as you keep exercising. And this results in the fourth thing, which is vasodilatation, which is expansion of the blood vessels or increase in their diameter and redistribution of blood. So redistribution is an interesting concept to understand where when you are doing an exercise which involves a lot of effort, especially if it involves the lower limbs where the muscles are large, your body redirects blood from other organs to that region which is exercising, and this causes some changes in the distribution of the flow of blood, which is called as redistribution. This is also an acute effect of exercise which could be dangerous in certain conditions. But again, when this happens controlled and is stimulated by moderate exercise, it is very beneficial in the long term because your body learns how to distribute blood when such stress happens unexpectedly during life. So once we have understood the acute effects of exercise, right, we know that for most people who are normal, these effects are manageable. And even for those who have cardiac problems or hypertension, when exercises are done moderately, consistently, and giving enough recovery, this shouldn't be a problem. But undiagnosed conditions, which could be pretty severe, can trigger cardiac events even when moderate or controlled exercise is done. So let us see in point number 2, who are the people who are susceptible to have cardiac events when they are exercising, even when they do not overstrain. First one is those who have hypertension. This can be uncontrolled hypertension on medication or those who have undiagnosed hypertension. It can also be a subset of people who know they have hypertension but are trying to control their hypertension through lifestyle changes. When they exert or overexert during exercise, the possibility of their BP increasing to that level that it could cause a problem to the functioning of the heart is very much possible. Second group, undiagnosed coronary artery disease. So just like we have blood vessels which supply all the other parts of the heart, there are blood vessels called coronary arteries which supply the muscles of the heart. When you have an undetected obstruction of those blood vessels or accumulation of plaque in them which causes a reduction of the space inside the vessels, it is called undiagnosed coronary artery disease. And if you exercise and increase your intensity without knowing that you have such a problem, this could also result in a cardiac event. The third thing is hypertrophic obstructive cardiomyopathy. This is a genetic condition where from birth the overall size of the heart muscles is larger. So when the surface area of a muscle is larger, you need more blood supply to help the muscle do its maximum function. So whenever such a heart is put under stress, there is a possibility of a cardiac event or the heart going into arrhythmia. The fourth group who are at risk are those who are at a risk of arrhythmia. So what is an arrhythmia? So in order for your heart to function, there has to be a rhythm in the beat, right? It has to go lub dub lub dub. At a certain heart rate, it is possible that the rhythm of your heart changes, which could really screw up the way your blood flow goes to the heart and to the other parts of the body, triggering a cardiac event. Then there is sudden cardiac arrest in athletes, which just happens in a subset of athletes, and we are really not sure why it happens, even though a lot of research is going on in that area. And also there is a subset where seemingly normal people who do not have any issues have experienced cardiac events when they have overexerted or overtrained suddenly. So overexertion should also be considered as a risk factor for sudden cardiac events, especially when you're not trained and especially when you're just inspired one day or motivated one day and you go and exercise. From this, there are also a lot of other conditions which are not as common as these, and I'm not going to delve deep into those, but these are the main conditions you need to know about. So from this, let's go into the benefits of exercise. So from these first 2 points, all of us will be wondering, okay, so exercise doesn't seem like a very good idea. No, it is a very good idea, but it becomes a good idea only when we know about all the dangers and all the benefits it can provide so that we can moderate it. It's like anything, right? It's like, so we drive, we know that there can be horrible accidents when we drive. But we also know that some people are not suited to be driving alone or driving too fast. Like if you can't see, for example, if I don't wear my glasses, I definitely shouldn't be driving. Or if somebody has night vision or they have a chance to get epilepsy, they should not drive. And so, or we know that if they do drive, the possibility of something bad happening is higher. We need to find out who is that subset when it comes to exercise, and we need to follow certain rules. That's the whole thing. And why we need to follow those rules, why we need to take these risks is the third point, which is the chronic effects or the long-term benefits of regular moderate intensity exercise with proper rest and recovery. So the first thing is improved heart efficiency. Yes, when you put the right amount of stress on your heart moderately, consistently, over time, your heart lowers its heart rate at rest and it also improves its stroke volume without actually causing too much increase in the work of the heart. So your heart efficiency improves over time. the amount of physical stress which used to cause your heart rate to increase significantly or high will not happen. So your heart efficiency, your blood pressure will not suddenly shoot up. So a main benefit is your heart efficiency increases with well-planned exercise. The second thing is your blood pressure also stabilizes. Over time, when you're on a guided exercise program for metabolic diseases, research is very clear that blood pressure is one of the factors which really reduces, and along with this, another lab parameter which shows significant improvement is also lipid levels. So when your heart rate reduces, your blood pressure stabilizes and your lipid levels also improve. Automatically, your risk of cardiac events reduces. So the long-term benefits of exercise for reducing cardiac events is actually a major reason why you should start exercise even if you have a risk of getting a cardiac event if you overtrain, because in the long run it is beneficial. Then weight management. So moderate consistent exercise is what I prescribe for all my patients who want to build muscle and also lose weight. Because when you want to lose weight, generally you're motivated by something you saw or something happened which has triggered off a wave of dopamine and you want to improve, or somebody insulted you or something like that. So the problem with that is your body is not ready for what your mind wants to do. Your mind wants to exercise and your mind thinks that I'm going to change my body really fast and prove them wrong or stuff like that. It doesn't work like that. You have to understand very, very clearly that you cannot be motivated, you have to be disciplined, because weight loss happens over a period of time. Let's go to the fourth segment. Why is pre-screening essential? So before starting or intensifying an exercise program, especially for those who have risk factors like obesity, hypertension, or a sedentary lifestyle, right? Professional evaluation is crucial, because your body is not used to sudden increases in your heart rate or sudden increases in your blood pressure or blood flow, because you're not used to doing heavy lifting or fast moving at all. So when you're exercising, you need to introduce your body very slowly to that kind of stress, right? So if you have a sedentary lifestyle, even though you might not have all the other risk factors, get a professional evaluation. It's very important. Now, what are the key steps? The first thing is you need to get a medical history review. In that, what I consider significant is if you've had any chest pain in the past, or if you've had a family history of cardiac disease or a cardiac death in the family, please have a pre-screening. Guys, you have to understand, if your waist is greater than 36, for every inch, whatever your age might be, your risk of mortality from sudden cardiac events increases. So if you have a big belly, however strong you are, right, you have a higher risk of cardiac disease, and you have to know this, and you have to pre-screen before intensifying a cardio workout also, especially if you are somebody who has only focused on strength all your life and haven't trained your heart specifically for cardiac performance or endurance. The third point, if you are somebody like this, an advanced cardiac screening is quite useful. By advanced, I don't mean go do a CT angiogram, nothing like that. A stress ECG, where your ECG is seen when you're walking and your heart rate increases, right? The rhythm of your heart and your heart waves are normal. And it also gives a safe heart rate where you can push your heart during exercise, and at that rate, your heart rhythm does not change. So a stress ECG is very, very useful, and also an echocardiogram at the advice of the cardiologist to rule out any valve issues or to check if your heart ejection fraction is good, to see how much we can increase your aerobic exercise or strength training might be advised by a cardiologist. And finally, so human beings need to be evaluated for what kind of exercises they can do. So there are 7 fundamental movements. There is the hinge, the lunge, the squat, the push, the pull, vertical and horizontal. You have the bracing where you hold your core in, and you have carrying weights from one area to another, one location to another, also known as locomotion. So assessment by a strength and conditioning coach to see your range of motion, your strength, your cardiac ability before planning your exercise intensity or your exercise prescription is also very necessary. So a basic pre-screening will include all these evaluations. And finally, if you're somebody who wants to exercise, you do not have any of these risk factors, and you want to know, okay, I just want to do exercises so that I can be healthy in the future. What are the rules I have to follow? So let me tell you that. So the first rule which I tell all my patients is start slowly and progress gradually. This is very important. See, avoid jumping into high intensity workouts. When you're overweight or you're obese and you jump, you injure a lot of the ligaments of your knees, especially your menisci, which are the shock absorbers. And those injuries will not allow you to exercise for a long time. So you need to be extremely cautious about suddenly starting off an exercise which is high impact just because you want to lose a lot of weight. Always go with planned exercises. The second thing is avoid overexertion. And if you're going to train one day where you want to test, I want to train my maximum, my suggestion to all my patients who are non-professional athletes is please do not try your PRs, because PRs are where I've seen most of the injuries. I know if you're a professional athlete you have to, but if you're non-professional, just try to focus on your form and progressive overload. If you want to do your PRs, please do it with a coach and with an entire team supervising if you do it right. And even then, I would suggest calculating your single PR by doing 3 rep maxes. That would be the safest way to go about it. Third point, use heart monitors and train in the maximal allowed heart rate, especially if you're training to increase your VO2 max or cardiac function. There is a point called adaptive resistance where your cell adapts to the resistance you place on the cell, right? So once the cell adapts, then you have to increase the resistance. So the amount of resistance which has to be applied has to be exactly right so that the cell doesn't get injured. Because when you put more resistance, adaptation doesn't happen, but injury happens. And our goal is to avoid injury. So consistent, moderate exercise. The third thing, you have to warm up and cool down. If you're exercising for 40 minutes, I would prescribe a 20-minute warm up with the ramp protocol and a 10-minute warm down. Finally, you have to make sure that your hydration and nutrition is good. If you train fasted, I'm very happy, I train fasted a lot, but if you're not used to it, please make sure that you eat something 90 minutes or 60 minutes before a light meal with a combination of complex carbs and protein, especially if you're going to train for performance. How fast is it able to recover from that exercise to be ready for another session so that you can get maximum output is very important. And you're not an athlete. It's 2 to 3 days a week, 2 days of strength training and 1 day of mobility and flexibility is ideal to start. I also go down to 1 day of strength training and 1 day of mobility when you're starting, because if your plan is to exercise for long term, starting off slow shouldn't be a problem. Actually, you should start off slow. For 3 months, you can go slow, set your schedule, and then up the ante. All right, guys. So, such incidents happening where people who are gym owners, who have already trained in the gym for a lot of time, having events like this is quite disturbing, and they have to be taken seriously. So what we have to understand here is, let's recognize that exercise can be dangerous for some. So when you deadlift, there is redistribution of blood to the lower limb, and so you could get dizzy. It's called orthostatic hypotension, and you could fall. When you fall, you could strike your head somewhere and you could get injured further. So when you're going to train or when you're going to push yourself, make sure you have some friends around you and you do it under supervision. So finally, what are the points that you should take away from this? First, awareness. If you are going to the gym, you have to know what are the symptoms of a cardiac event And also make sure that your gym is equipped with trainers who know CPR, and if they have an electric defibrillator and the trainers know how to use it, nothing like that. We don't eat well. We don't have a healthy lifestyle. We're not sleeping, right? Especially if you're not sleeping, even though you might have otherwise healthy habits, your heart is going to get affected. So please expect that you might have some lifestyle diseases. Screen yourself and then start exercising so that you get the benefits and not the complications of exercise. So guys, don't be scared of exercise, but be scared of not being informed well enough to do exercise which will benefit your body and not harm you. If you found this useful, please do subscribe and also share it with your friends who are thinking about exercise but you think might be scared because such events are happening. All right, see you guys soon in the next video.